So our physical therapy degree program will prepare students to first and foremost sit for the national licensure examination to become licensed physical therapists and be able to practice in a variety of settings across the healthcare field. These include inpatient services, outpatient services, work in school districts, work in private practice settings, and even more recently, moving into direct access and primary care extender roles within the medical system. So earning your Doctorate of Physical Therapy degree from the University of Texas Rio Grande Valley is really designed to help reinforce and improve healthcare and access to healthcare for residents of the Rio Grande Valley. There are some unique features to our program. We have a very regional focus, so this includes things like diabetes, heart disease, what we call metabolic disorder, which is a combination of high blood pressure, high blood sugar, obesity, things of that nature, to really make a lifestyle change for patients who come and see us. One of the other things that is somewhat unique about our program is we will have Spanish integrated throughout the program, which most programs don't actually have. The way that we're planning to do that is that we'll have a dedicated Spanish medical terminology course within the program, and then we will have, beyond that, we'll train students to work with patients directly in both real and simulated situations in providing plans of care and patient education in Spanish. This program is a 3-year full-time academic program. The first 2 years of the program will be all laboratory and classroom-based. The third year of the program will be 4 full-time clinical rotations. So students can expect coming into the program to work with really a very world-class faculty. We've got faculty members who specialize in sports medicine, in orthopedic physical therapy, in neurologic physical therapy, in women's health issues, pediatrics, geriatrics, etc. So our faculty is very much dedicated to helping the student develop and grow as a professional and as a clinician. And we look at this relationship as being more than just a teacher to student interaction. This is about mentorship and collegiality. So we're working with students who ultimately we want them to be able to treat our own family members and work with them as colleagues after their graduation.